Ensuring sustainable and equitable access to pharmacy-based vaccinations relies on robust funding and reimbursement models. In this video, we will explore the funding and reimbursement models for pharmacy-based vaccination in 7 different countries. Public funding, private insurance reimbursements, and targeted support for underserved communities are key to maintaining access for all, helping to improve public health outcomes. So now, let's discuss the available reimbursement models for pharmacy-based vaccination services across these 7 countries. Many countries have similar reimbursement structures for healthcare services, with most relying on a combination of public and private systems. For example, the United Kingdom, the United States of America, Australia, and Ireland offer a mix of public and private reimbursement system, with some services directly paid for by the customer. France and Canada rely primarily on public health system reimbursements. In Portugal, the public national health system funds pharmacy-based vaccination for certain population groups, but there is also private insurance coverage and out-of-pocket payments by patients not covered by the previous systems. This comparison illustrates the different approaches to healthcare funding, highlighting the balance between public and private systems globally. Pharmacy payment for vaccine administration varies significantly across countries, reflecting differences in healthcare policies and reimbursement structures. The payment structure for reimbursed vaccines varies across the 4 nations of the United Kingdom. In England, pharmacies under NHS-funded vaccination programs receive separate reimbursements for vaccine costs and service fees. For the 2024-2025 flu season, pharmacies are paid £9.5 per vaccine administered, plus reimbursement for the vaccine's current basic price. Also, an extra fee of £2.5 is paid for administering COVID-19 vaccines outside the flu season. Wales operates under a central procurement model where vaccines are supplied free of charge to providers like pharmacists. For the 2025 flu season, pharmacists will not purchase vaccines but will receive a service fee for administering those procured by NHS Wales. In Scotland, vaccine services are managed by health boards, which determine delivery routes based on geography, population size, and diversity. Providers administer centrally procured vaccines and are paid a service fee, as outlined in Scotland's 5-year vaccination and immunisation strategy. In France, the reimbursement for vaccinations is standardized across the public health system and private health insurers. Vaccine administration without prescribing by the pharmacist is reimbursed at €7.5, including VAT. Vaccinations that involve prescribing and administration by the pharmacist are reimbursed at €9.6, including VAT. To better understand vaccination service reimbursement, let's hear from the president of the French Chamber of Pharmacists.
In France, the patients have nothing to pay when they get vaccination, nor the vaccine, neither the administration, and the pharmacist, when he does that, receive a fee which is different whether he prescribe and administer or just administer, which is going between 10 and €7.
In Australia, under the National Immunisation Programme (NIP), vaccines are provided free of charge, but pharmacies can charge for administering them unless government reimbursement applies. Pharmacies administering COVID-19 vaccines receive administration fees of $27.35 in urban areas and $30.5 in rural areas, with additional compensation for off-site visits. Further remuneration is available for state-funded programs such as flu and Japanese encephalitis vaccines. Starting July 2024, the Australian government pays $19.32 per NIP vaccine administered to individuals over 5 years old. Initially, patients in Portugal paid out of pocket for pharmacy-based vaccination services. However, over time, insurance companies and corporations began covering these costs. Today, the National Health System (NHS) reimburses vaccination services for specific age or other risk groups, increasing access to essential vaccines. In 2023-2024, as part of the national vaccination campaign, the Ministry of Health included community pharmacies in the program. Pharmacies now offer co-administration of influenza and COVID-19 vaccines and are reimbursed for these services under the National Health Budget. To better understand vaccination service reimbursement in Portugal, let's hear from the president of the National Pharmacy Association, or ANAP.
So vaccines that are outside the national vaccination plan and are administered in the community pharmacy, they are usually paid for by the individual with a reimbursement based on a prescription, and the administration service is paid out of pocket by patients. In COVID-19 and flu campaigns for eligible population, these are provided for free to the public via the community pharmacy and also via the healthcare centers.
In Ireland, community pharmacies are fully reimbursed by the state for administering COVID-19 and seasonal flu vaccines, with free vaccines provided to at-risk groups. To boost COVID-19 vaccination rates, additional fees are offered as incentives. Both pharmacists and general practitioners receive equal compensation for administering vaccines, ensuring fairness and promoting collaboration between healthcare professionals. This helps make vaccines more accessible while maintaining equity across the healthcare system. This table outlines the payment structures for pharmacy administering vaccines across 5 different countries, highlighting the variations in reimbursement strategies, starting with Australia, Canada, France, Ireland, Portugal, the United Kingdom, and the United States of America. Expanding the role of pharmacists in vaccination programs is transforming healthcare by making essential immunizations more accessible, cost-effective, and integrated into community care. Now let's explore how pharmacy-based vaccination programs are transforming healthcare by improving patient outcomes and enhancing system-wide efficiency. 1. According to a recent report by the Office of Health Economics, adult vaccination against 4 diseases, seasonal influenza, pneumococcal disease, herpes zoster, and RSV, can return up to 19 times their initial investment to society when their benefits beyond the healthcare system are monetized. 2. Pharmacies play a crucial role in increasing vaccination coverage, especially during influenza outbreaks. For example, during an influenza epidemic, pharmacies could help mitigate up to 23.7 million symptomatic cases. This could result in savings of up to $2.8 billion for third-party payers, while providing society with an impressive $99.8 billion in savings. Beyond economic advantages, pharmacy-driven vaccinations have a significant impact on global health, particularly for non-communicable diseases. With non-communicable diseases responsible for 74% of global deaths and over 64% of all disability-adjusted life years, effective vaccines could dramatically improve health outcomes on a global scale. Pharmacist-led interventions also show substantial success in increasing vaccination rates. Proactive communication and in-pharmacy discussions drive these rates significantly higher than standard care alone. Shifting vaccine services to pharmacies not only enhances access but also reduces the burden on traditional healthcare providers, freeing physicians to focus on critical patient care activities. Also, vaccinations play a crucial role in preventing infections, which helps mitigate exacerbation of non-communicable diseases. By doing so, pharmacies are reducing the healthcare burden and lowering the social and economic impacts of these diseases. This creates a more resilient and cost-effective healthcare system. Finally, vaccinations have proven to reduce the number of hospital emergency visits. This helps to ease pressure on healthcare systems, leading to fewer hospitalizations and ultimately lowering hospitalization costs. The FIP Pharmacy-Based Vaccination Surveillance Atlas is an open-access interactive tool providing detailed data on pharmacy-based vaccination services around the world. You can explore country profiles, summaries, maps, and graphs based on FIP member contributions. We hope this video has inspired you to explore the various funding and reimbursement models for pharmacy-based vaccination services, as well as the significant healthcare outcomes and enhanced efficiency these services can deliver. Thank you for watching.